Hello, this is Dr.Sankar Kausik. I'm the director of the BPH program for Chesapeake Urology. I would like to talk to you today about Rezum, which is an exciting new treatment for benign prostatic hyperplasia. What you need to know prior to minimally invasive surgery. So let's start with the basics. What is BPH? BPH, or benign prostatic hyperplasia, is a term that describes the non-cancerous growth of the prostate that can result in blockage of the urinary tract and results in changes in urinary symptoms such as more frequent urination, a sudden urge to urinate, slowness of the urinary stream, or incomplete bladder emptying. What is minimally invasive therapy for BPH? Minimally invasive therapies are procedures done through telescopes or catheters that either vaporize tissue or scrape tissue out to create a larger passage for urine flow. Rezum delivers radiofrequency generated thermal therapy in the form of water vapor directly to the extraprostatic tissue, causing it to shrink. Urolift, which is another exciting therapy, uses tiny implants to hold the prostate lobes apart, like open curtains on a window, to relieve compression on the urethra. Photoselective vaporization of the prostate, also known as green light laser, uses a laser fiber to vaporize tissue. Transurethral resection of the prostate, or TURP, uses an instrument which scrapes the tissue out to widen the channel. Transurethral microwave therapy, or TUMT, uses a catheter to heat the prostate, causing it to shrink over time. What are the indications for a minimally invasive procedure? These can include urinary symptoms that are not adequately controlled with medication, or as an alternative to use for long-term medication, urinary retention or inability to urinate or empty the bladder, recurrent urinary tract infections related to an enlarged prostate, or recurrent blood in the urine related to an enlarged prostate. What is Rezum? Rezum is a transurethral needle ablation procedure to treat benign prostatic hyperplasia that can be performed in a clinic or outpatient setting. This technology delivers radiofrequency generated thermal therapy in the form of water vapor directly to the extraprostatic tissue, which causes the tissue to shrink and thereby improves symptoms such as frequency, urgency, weak stream, or straining to urinate. The radiofrequency energy transferred by the water damages the cells, causing cell shrinkage and death. Over time, your body will absorb the treated tissue through its natural healing response. Rezum provides the following benefits. It is a potential alternative to long-term use of prostate medications. It relieves symptoms safely and effectively. It provides noticeable symptom improvement within 2 weeks. The treatment is simple, done in the office, and is an outpatient procedure. It does not require the use of general anesthesia. It does preserve your sexual and urinary function and allows patients to return to normal, regular activities within a few days. The Rezum system is a novel treatment which uses sterile water vapor or steam to shrink BPH. This is done by delivering targeted controlled doses of stored thermal energy directly to the region of the prostate which is causing the blockage. A narrow device, similar in shape and size to a cystoscope, is inserted transurethral under direct visualization and positioned within the prostatic urethra. What are the risks of the procedure? Most of the side effects with Rezum may last for a short period of time and are self-limited, which means they will resolve typically in 2 to 4 weeks. Potential risks, although unlikely, can include infection, bleeding, scar tissue, reduced ejaculatory volume, other sexual side effects, or failure to improve urinary symptoms. Temporary urinary retention may require the use of a catheter or need to perform intermittent catheterization, usually just for a few days. Rezum recovery. After the treatment, almost all patients will go home the same day, some without a catheter. There is minimal downtime post-treatment, and many patients will experience symptom relief in as soon as 2 weeks. Patients may experience some mild urinary discomfort during the recovery period. The most common side effects may include light blood in the urine, some pain or discomfort with urination, increased frequency or urgency to urinate, and discomfort in the pelvis that typically resolves within 2 to 4 weeks after the procedure. Your doctor will discuss with you how quickly you can return to your normal physical activities. Pre-procedure information. Because the procedure may be done under anesthesia, you may need to fast starting the night before the procedure. Certain medications, such as blood thinners, may need to be held several days before the procedure. A preoperative exam, including blood work and an EKG, is usually required and will need to be done by your primary care physician. You will need a ride home from the procedure and a responsible adult available for the first night after the procedure. Your doctor will tell you if you will require anesthesia or whether this can be done under local anesthesia. The procedure may be performed in the Chesapeake Urology Summit Ambulatory Surgery Center or in a Chesapeake Urology office. These are usually either adjacent to your urologist's office or in close proximity. These centers are specifically for outpatient procedures. Some patients may need their procedure performed in a hospital, usually related to medical conditions. What does the procedure entail? The patient is brought into the procedure room and placed on the table. You will be placed comfortably in the lithotomy position. A local anesthetic will be administered into the urethra or urinary channel. If you are receiving anesthesia, it will be administered by a board-certified anesthesiologist. Once the anesthetic has been placed, a telescope will be passed gently into the urethra and into the area of the prostate. Radiofrequency power from the system generator is then applied, which heats upon contact with the tissue. The vapor immediately injures the prostate, causing the cells to shrink. Over time, the prostate tissue is absorbed by the body's immune system response, which reduces the compression of the urethra and enables improved urine flow. What can you expect after the procedure? A catheter may be placed for 1 to 2 days after the procedure if you are unable to urinate to prevent immediate postoperative swelling. You may notice blood in your urine for up to 6 weeks following the procedure. But if there is worsening bleeding, clots, or difficulty with urination, you need to contact us. Irritating urinary symptoms, such as a constant need to urinate, intermittent burning, or more frequent voiding, can occur and last for several weeks to months, depending on the healing process and size of the prostate. Discharge medications. You will usually receive a prescription for an antibiotic for 1 to 2 days, along with medications to help with burning or pain. You may also need a stool softener. Things to let the doctor know about. If in the recovery period you experience a fever greater than 101.5 degrees, chills, nausea or vomiting, severe pain, inability to urinate, passage of significant blood in the urine or clots causing lightheadedness or dizziness, you should contact your doctor's office right away. Pre-authorization process. The pre-authorization process is essential. We will communicate with your insurance to determine your coverage and any co-payments or deductibles that you may owe. We will provide you with an estimate of any charges that you may incur. All charges are due prior to the procedure. However, payment plans can be arranged if needed. How do I get scheduled? A surgical scheduler will give you a date for your procedure. If you are having anesthesia, you will need medical clearance with your primary care physician or internist, including a history and physical exam. Additional testing may include blood work, an EKG, and a chest X-ray. You will receive a letter with all of this information, as well as where and when to report. Is there special preparation for surgery? If you are receiving anesthesia, you should not eat or drink after midnight. Our preoperative nurse will call you and discuss medications to take in the morning prior to surgery. If you are taking a blood thinner, please let your surgeon know, as special precautions may need to be taken. Never stop these medications without a discussion with your primary care physician. These medications include aspirin or Plavix, Coumadin, Xarelto, Eliquis, or Pradaxa. Arrive early. We usually expect you at least 1 hour prior to your scheduled surgery. If you are getting anesthesia, make sure you have a ride home. That person must come with you to check in and stay the entire time of the procedure. Finally, we hope that your procedure goes well and that you have a speedy recovery. We appreciate your feedback regarding your procedure, as we are always trying to improve the care that we provide our patients. Should you have any questions regarding your procedure or recovery, please contact your Chesapeake Urology physician's office at 877-422-8237.